Hi, this is Dr. Scott Waugh again with the Regen Room. I want you to know about a little tool we have here that kind of sets us apart. So one of the things you'll find when you talk to other doctors or other regenerative medicine clinics and how they measure outcomes, they're really looking at a pain score only. So we're blessed to have this new technology. It's a sensor technology that measures balance, gait, symmetry, and range of motion. And we can do that at the beginning to get a baseline. And then we can institute our 90-day on-ramp program with the regenerative therapy to get you back on track. And then we'll measure it again at the end after you've been through the treatment, you've been through your strengthening program and all of that stuff. And we'll remeasure just to show you and us how well you're doing. So we have a patient here today. This is our patient advocate, James Odo. So he's got the sensor on, and it is hard not to laugh when you're wearing a green flashing box on your head. But we're going to do a quick 10-second evaluation here. So we're going to go ahead and push start. So this is measuring balance. Great. So here it gives us some quantifiable data that we can compare in the future. So if James had neuropathy that was significantly affecting his balance, it would be very obvious here. And what's important about this is if you're off balance, or if you are not engaging one side of the body or the other, you get these compensatory changes that perhaps you only had one problem a year ago, but a year or two down the road, now you have another problem because the other side has been compensating for it. So this is a really valuable tool that helps guide treatment, and it also helps us measure outcome. So let's zoom in and see how James did on this test. So we have the timeline for his balance. We just did a quick 10-second test. So when we look at this deviation category, we can zoom in here, and Jim actually did a really good job staying near the center. But this is how frequently he was kind of off balance and moving away. And then the recovery is how quickly he's recovering from that and getting back to the center. So he did really, really well. But if we, again, take somebody with neuropathy, specifically, there's some other things too, but this will be much more dynamic. We'll see a lot more moving, both in deviation and recovery. And we hope that circle gets smaller and smaller as we work on regenerative therapy and some of our mechanical programs with the athletic room.